is Dr. Lewis from the Council for Professional Recognition. We are so thankful to have her here today. It's very exciting what she's going to be sharing with us today because I don't know if folks have been participating in webinars and such that the Council has had to kind of start explaining where we're going next with this Child Development Professional Credential, which is new. I also find it exciting because we can start to have some conversations about what that means for Ohio. How will we potentially use that for stacking credentials, and a lot of great discussion that we can be thinking about while this is continuing. So thank you so much for coming and welcome.
Thank you. So I'm just really excited about all the work that's happening in Ohio. You all are ahead of the curve on a lot of this, so I'm hoping you'll be able to just slide this little puzzle piece into your current neatly fit puzzle. So, and I will answer some of the questions you guys were having discussions about during Nikki's presentation, and hope to support those responses, okay? Yep, you guys are doing, again, great work. It's just finding out where to find it. Yeah, that support. So we'll be talking about the CDP in this session today, but again, answer some of your questions about the CDA. This is my team, the EC Competence Practice team. It's a new team at the council, developed last April. So I may stop saying new after however long someone said this morning, right? We'll determine. But Vilma has been at the council for 40 years. She started a week after the council became an organization. Wow. And so I'm happy to have her on my team because she's always sharing with us how they came to different decisions, and we're trying not to repeat mistakes that were made in the past, but also considering what worked or what didn't work for that time and how to bring us forward into the present and the future. So love having Vilma on my team as senior manager of EC Competence Special Population. She is the team member at the council who's going to make sure everything gets translated into different languages. So thank Vilma for all of that work. And then Dr. Marie Masterson started with us last October. We pulled her from the McCormick Center. She helped develop that whole leadership framework, if you've seen the whole leadership framework. So Marie is like myself. We are both authors and speakers, so we both have higher ed backgrounds. I have an EC background as well. Marie helps to build systems. So our team was built as an internal expert team. For decades, the council depended on, consultants in the field. And so not that we are not currently asking for feedback from people in the field, but now we have an internal team who specializes in ECE. So in today's session, as Judith said, we're going to dig into a little bit about what the CDP is. Who's heard of it, first of all? Okay, great. So you're going to dig into a little bit about what it is and figure out where you can fit it. And before I forget, because there's so many PD specialists in the room, can we take a PD specialist pick before I leave? Where are the PD specialists again? Yeah, let's take one. Mackenzie, she's director of the EC Observations Systems team in our department, and she's on maternity leave right now with a beautiful little baby. So want to make sure we send Mackenzie a pick. So. How many of you all already knew about the council before you started your current role? Because I know, okay, good. How many of you all already knew that the council offered the CDA credential? Okay, some people call it the CDA council, right? They don't know that it's the Council for Professional Recognition. But this organization started in 1985. Who knows when the first CDA was awarded?
75.
Yes! We got some prizes. Do we have prizes? The first CDA was awarded in 1975. The math is, you're going, huh? So 10 years before the council. Yeah. So 10 years before the council became an entity itself, CDAs were already being awarded, right? Quick bit of history. So all these educators, experts, 50 plus years ago, early 1970s, they were trying to figure out how to credential educators. One credential that shows high quality, folks out there in the field doing the work. They were having a hard time finding and credentialing Head Start teachers because they have all of this work to do. The requirements are so extensive. Who's going to make sure they can do this job? So the CDA was created. It was born out of a work group from what organization? Who knows? I'm testing y'all today, I know. NACI. I like this because people don't know. Yeah, you're right. So people don't realize that this group that was working with in NACI, who's a part of some governing board or something with NACI, one of those, right, that we've all served on. And so they were trying to figure out, how can we offer this credential? Well, NACI did not want to be the credentialing organization because of, possible conflict of interest, being, offering accreditation. And so a separate entity started the work. Bank Street College took on the work and started awarding the CDA credential. But they found it was so tough, the assessment. You guys knew what it takes to assess someone to fully go through that process. It's a lot. So Bank Street College, they all got together and said, we need another entity in ECE. And that's when NACI supported the creation of the council. And so that's why it was 10 years later. So that history is important because people forget. All of us in the room have the same goal of making sure we have quality early educators. So just like they did over 50 years ago, we're still doing the same work in different states. So just wanted to give you a little background on the council, and our goal is to make sure we have quality early childhood education teachers. So again, the CDA is 50 this year, so it is our anniversary of the CDA credential and the 40th anniversary of the council as an organization. You all may already know it's nationally recognized credential, transferable competency base, which is really huge. The CDA focuses on what an educator can do, not just what they know, but those KSAs, those knowledge, skills, and abilities is what the CDA focuses on. So I want you guys to just talk a little bit. I'm an early educator myself, so I like to do a little activity. But what obstacles do early educators face when working toward career advancement? You can throw up your hand if you want, or just yell it out. Yes?
Having time, because they're working all day in a classroom.
They're working all day in the classroom, so having the time. Yes?
Support of their employers.
Support of their employers. I remember my leader was allowing me to leave every day for a 1 o'clock class. And it was the only time I could take that class. It was the only time it was offered. So every day at 1, she let me leave, go take that class. Everyone doesn't allow that, right? And that's how I earned my degree. I needed that one class to finish. Yes?
The knowledge of how to navigate next steps, how to navigate higher ed.
You all talked about that earlier, right? When you were asking your questions, you can have the education all day, but how do you complete a process? Yes? I saw someone back here. So all of those are correct, right? So they're having a difficult time finishing their work. You'll have the slide, so PDF of this, and you'll be able to click on this information. But who's seen the EC Workforce Index before? Right, so you'll have the latest one that came out as of last year. Y'all, this statement just hurts my heart.
Oh, yeah.
Right? The EC workforce is compensated at lower rates than 97% of all professions. Does that hurt?
Yes.
Oh my gosh, and they're the ones who are taking care of our most prized possessions. 97%. So here's some workforce data, and I just want to briefly go through it. But this median range, hourly wage is just crazy across the country. It's about $13 nationally. But states like Louisiana, District of Columbia can range between 10 and 18 based on the funding that they have. But if you're an elementary and middle school teacher, you make around $31. The rest of occupations around, almost $23. Look how low we are, right? But here's some variations. It depends on the setting. Which teachers do you think make less in ECE? Who do they take care of? The infant toddler teachers make less than everybody. So if you're an infant toddler teacher, be prepared to get paid less, right? And then the funding stream is different. Let's say you are a preschool teacher, a preschooler teacher, ages 3 to 5. It depends on whether there's pre-K funding, state pre-K funding, or some type of grant that's received, some type of state support or nationally supported program, Head Start, for instance. that's what can also affect how much you get paid. So there are 3-year-old teachers, based on the program they work in, who make significantly different amounts in terms of their pay. And here's the other thing that's different than many other professions. The age of the children is what pay is often based on, not the education or qualifications of the teacher. I've had teachers when I was a senior director who had master's degrees. They weren't paid based on their degrees. They were paid based on whether you were a pre-K Head Start teacher. Yeah, so it's important that we are paying our teachers. And you all know this is a conversation we always have. Pay equity is huge. We have them jump through all these hoops, and we don't always make sure that it's worth it when they're done. So just wanted to share a little bit of workforce data there. I've had a great career in ECE, but our teachers who work with our youngest children we need to make sure they're taken care of. A little bit more data. Let's start with the degrees on this side. So about 30% of center-based and about 20% of home-based hold a BS degree, hold a bachelor's degree of some type. About 18% of center-based, 18% and 20% of home-based hold an associate degree. So kind of about half hold some type of degree. 65% of EC programs experience high vacancies. We know this, right? So many programs have had to close classrooms because they couldn't find teachers who met the required qualification levels. 43% staff turnover rate in birth to 5 programs. People don't stay in our field, and it's often because of money. And some of them love the children, but some of them also can't meet the requirements that are needed to be a teacher in the field. And I heard a little bit this morning, so this is great. We're moving our supports from equality to equity because everyone's needs are different, right? The proportion of early educators who are in these different categories is increasing. So it's their first generation increasing, attending school part-time increasing, in need of wraparound supports, non-white racial background, working while enrolled, in need of developmental education, bilingual. All of these different categories are increasing in the field, the number of people who are trying to earn their credentials and work in the field. So here's some data. Again, you have the links to all of this in the, when you have the PDF. In 2021, NHSA, the National Head Start Association, published a broader, deeper, fair report, 5 strategies to radically expand the EC talent pool. And with this report, these are just some of the data that was in there. We need to redefine credentials. That was one of the first recommendations if we want to radically expand our talent pool. Create a second credential that layers onto the CDA. And they specifically said a national credential. Like, I love all the presentations today. So I came early so I could listen in to see what's going on in Ohio. But listen, y'all, you can go to every state. We have our own acronyms in every state, right? Even though we have the national ones, we have so many acronyms in different states. So I learned some new acronyms today. It's important across the nation that we have some that are the same. You know, some states have their own state credentials. I live in Georgia, and we have a state credential, the TCC, the Technical Certificate of Credit. You can go to any technical college in Georgia, earn a TCC in infant, toddler, and preschool. There are different ones. But if I move to Florida, will they recognize that TCC? Maybe or maybe not. So we place the CDA on the same level on our career pathway so they can earn their CDA as well. And when they do go to another state, at least they know what a CDA is. So I love that you all are aligning in Ohio. Rethink degree attainment. We'll talk about that. Optimize practice-based credentialing. I love this morning the presentation that talked about how you all are looking at experience. Expand job-embedded coaching. Love the mentoring with the apprenticeship program that's happening. Connect in-service preparation with career development. So who has worked in the classroom with children before? When did you really learn what to do with them? Still learning. Someone said still learning. Was it when you had your wonderful education and you finished your credential? It was after you actually got the job. Student teaching was an eye-opener, right? Rude awakening, like, oh, wow. So it was actually doing the job that helped you learn how to do the job even better, right? What the job really entailed. You can read about something all day long and do activities around it, but it's being in that real world situation. So we want to give credit for that experience in the learning. Some more research that you'll have a link to that's really important. The council partnered with Research for Action and Early Educator Investment Collaborative to do another study in 2021. In this feasibility study, there were 5 findings that came out. We were trying to figure out if we're going to offer a National Lead Teacher certification and the country is going to recognize it as such, what needs to happen? Because here's the thing. Some states recognize the CDA as a National Lead Teacher certification. Some don't. It's not consistent. So the CDA prepares you to work in the classroom, but it doesn't solidify you as a National Lead Teacher. It's not a certification at that level. So that's what needs to happen. But before we can have a National Lead Teacher certification, policy actions. We need to make sure that there's investment in our workforce that remedies these inequities that we have. So scholarship funds, I love that you guys have TEACH, loan forgiveness, tax credit, universal pay increases. Some of the things that need to happen. Then higher education support, expand access to programs, so alternative locations, class time. I'm sure some of you guys have classes in satellite locations, or you have online hybrid courses, right? Your classes are in the evenings, hopefully. So offering classes at times where they can actually go to class different times. So making sure higher ed is available. Innovative financing, so atypical funds. For instance, Medicaid, WIOA. WIOA is Workforce Investment Opportunity Act. So some of the funds that you all have may fall into some of those buckets, but making sure that we are using financing in different ways. Whether it's providing childcare while they're in class. So again, a lot of things you all said this morning that have been said today are supportive of innovation. And then EC employers, paid release time for professional development. Do you know any employers who allow their teachers who pay them when they are taking coursework outside of work time? Good. Teach, they're teach, right? They have teach. We want more employers doing that. If they take a Saturday course, helping them, providing some funds for that. High quality practicum experiences, apprenticeship programs. So you guys are doing a great job here. And then advocacy. Greater public investment to increase compensation for the workforce. So, pay is always going to come up in our field, and it'll be great one day when it doesn't. So you have in your folder a handout. Thank you to Judith and the team for making this available. This is the CDP concept paper. It's on the right side and the back. Yep. So the CDP concept paper was released on May 6th of this year with the goal of just letting the world know that the council is considering offering this new credential. What would it do? What would it help? What could it be? And so since then, we've been having monthly webinars, live stream webinars, just to talk about this concept. Who's participated in one of the live webinars? Yay! All right, so we have 4 since June. And so having this conversation around what would it look like to have a new credential, national credential, that layers onto the CDA and is recognized once a lead teacher has experience. They're not entry level anymore. Now they have experience in the profession, and we want to recognize them as such. Currently, when a student finishes high school, if they finish the CTE program, yay! And they earn the CDA as their end of pathway assessment, they took the CDA, they earned the CDA. Well, great. Well, if I've been teaching 10 years as a lead teacher, do I want the same credential as someone who just finished high school? Do I want the same credential as someone who's just entering the profession? I should be shown to the world as someone who has advanced competency and that I have done and can do the job as lead teacher. So here's the document in English and Spanish, but also when you go to our website, you can always change our website to Spanish if you like at the top. So you have it, and you'll have links later as well. So here's the difference between the CDA and the CDP. The CDA, again, is entry level. They're just starting their career or just deciding, I think I like it here. I may as well go ahead and start professionalizing my career. But a CDP is, they're experienced. They've been doing the job of lead teacher. Currently in the concept paper, we say at least 2 years. And we came about the 2 years, we didn't want to create a whole nother barrier for educators. In 2 years, I could have earned my associate degree, right? So 2 years of experience. Let's compare that to a CDA. How many work experience hours does a CDA have to have? 480 hours. So 2 years of experience equals 4,000 hours full-time, 2,000 hours part-time. If you don't think I'm competent by then, I don't know what to say, right? So a lot more hours than the CDA, but I'm working in the role as lead teachers. Do CDAs have to be working? Do CDAs have to be working? They can be volunteers. They don't have to have those background checks as you heard this morning, right? But they can be volunteering and earning their hours. But a CDP will have had to have been working in the role of lead teacher for at least 2 years to be considered. Now, do they have to be in that role at this very moment? We're discussing that because everybody's already talking about, what about directors? This is a national lead teacher certification. So for each of the competency goals, and we're gonna go over those briefly and then I'll show you how you can account for the training. So for each of the competency goals, the CDA competency goals, the CDA, they demonstrate knowledge and skills in performing the work with young children in the role of teacher. But CDPs, they understand the art and science of teaching. They've mastered, keyword, mastered the role of lead teacher, and they're also guiding, supporting, and advocating the professional development of practitioners along with continuous quality improvement of program. So oftentimes they're supporting others in their program. They may be a PDS, because as of last year, CDAs can now be a PD specialist. Okay, they have to have more years of experience than you, but now CDAs can be PD specialists. We've been asked that for a long time, and that's because we have CDAs who have been working for a very long time. I've seen CDAs, they've been CDAs for 27 years. And so we wanted to provide a pathway for them to also be PD specialists, but again, they have to have more experience than you all. So these are the 8 CDA subject areas. So this is the conversation that came up a little while ago today. And you were talking about the areas where they have to have training. So these 8 CDA subject areas, if you're in higher ed, you're teaching this somewhere in your EC program. You have to figure out what course you're teaching it in, right? What we often find is intro to early childhood, health, safety, nutrition, or whatever your wellness course is, and whatever your child development, human growth and development course is. Those are the 3 that are often aligned. But here's the thing. Some colleges have gotten really innovative, and this really doesn't require innovation. Practicum. If there's practicum student teaching, they give them credit for their course, their coursework, because that practicum is going to help them with the 480 hours, right? And so some people have started to give credit for practicum. Some give credit for assessment evaluation, but you all can look at your syllabi to determine. So I'm going to go from here to our website and show you how you can align your work. So if you go to our website, and this is going to answer the question earlier about, the CDA subject areas. As PDSs, you should not be trying to figure out on a visit you should not be trying to do all that work, right? So if you go to partnering organizations, click on National Workforce Registry Alliance. So NWRA, the council has a partnership with the National Workforce Registry Alliance, NWRA. And any state that is also an NWRA partner, the state registries, through our partnership with NWRA, the coursework is aligned with the CDA subject areas. And so you can download a transcript that already shows the courses that a practitioner's taken. So Ohio is on here. So I'm going to scroll down because you can also see approved state registries there. And once you scroll, you see Ohio, and you can click on a sample transcript. So there's Ohio, and I can click on a sample transcript, and it will show me a sample of the CDA subject areas and what hours, what training this particular student has taken. And as a PDS, I can say, oh, good, they're approved, they're good. Now, sounds like a conversation you may need to have, and we may have time for that today, we'll see, is how we can make sure the college courses are in there, right? So sounds like some of them are already approved through the articulation, and I love that you guys have a whole transfer team. So maybe that's a conversation that needs to be had where these courses can be plugged into the registry. So again, I don't know, today or another day. But the good thing is that you're on here, because some states aren't on here yet. So you're already here, and just figuring out where to make it easier for the PDSs is what needs to happen. So I wanted to show that to you all. One thing that my team has done as well is we have started to develop and make available some alignment. So the CDA competency standards are what's most important. Everything, all the content is arranged around that. So I'm going to go back one slide. These 8 CDA subject areas were derived from the CDA competency standards. But they cover the theory and practice. It's a guide to make sure that educators who are providing the coursework or training, that they understand what coursework needs to be provided. So of the 8 CDA subject areas, they have to have a certain amount of training in each one. Who knows how many? 10, yeah, 10 hours in each of those areas, which is 80 hours. So the remaining 40, because they have to have 120, the remaining 40 can be in any of those hours, any of those areas. But the CDA subject areas come from the CDA competency standards. So these are the CDA competency standards in terms of how they're organized. They're organized by goals and functional areas, right? And then they go deeper into indicators and items and, but this is the basis of it. But again, they are aligned with those 8. So candidates they have to demonstrate that they can perform knowledge, skills, and abilities. They're assessed by, the KSAs are assessed in this way. So if you want to earn your CDA, there are multiple forms of assessment that happens. You have to have a portfolio in addition to the 120 hours of training, 480 hours of experience, you said it earlier, your portfolio, you take a CDA exam, it's about 65 items or questions, and then you also have observations. Advanced class, yes, I love it. A verification visit that you guys, the PDSs, are performing. And so after I have done all of that, the council determines if I'm awarded my CDA, right? And so conversations come up all the time about, well, what about, how good the training was? We don't know who did their training. And so we're trying to make sure people focus on what they're earning and all they went through to earn it. When you got your driver's license, did anyone ask you how good your driver's license course was? Who taught your driver's course, your driver's ed course? How good was it? Right? When you got your high school diploma and you went to the college and said, here's my high school diploma, did they say, well, who taught your algebra class? How good was your algebra class? What about your English 101? Right? We have to make sure that we're acknowledging all the multiple sources of evidence that CDAs are providing. And I'm preaching to the choir because Ohio is doing just that, right? So give yourselves a hand for all the work you're doing. I love that. All right. So some quick highlights of the CDP, and I'm gonna get you guys up and moving in a second. So it's a workforce solution validating lead teacher competency. We want to keep it in its frame, right? Lead teacher competency. Nationally recognized certification pathway building on the CDA. So we want that term, National Lead Teacher Certification, recognized. It's designed for CDAs who have mastered the CDA competency standards. Yes, 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 because it's in your head. You're thinking it. What about people who have degrees already in ECE and they want to earn their CDP? You were thinking it, right? I know. Yeah. We're having the conversation, okay. We are having a conversation about, with our psychometrics team, about measuring competency for non-CDAs who may already have your associate degree or your state credential. So we are having the conversation about that. So just want to let you know. Promotes equitable access to professional career advancement. The CDP requires higher levels of practice-based experiences. The CDA is the best first step, and we're wanting the CDP to be recognized as the best next step as the national credentialing, national certification in our profession. So just some highlights about the CDP. And before I move on to this little activity, because we're going to be getting up and moving, we want to get your input. That's one reason I'm here. I want to get your input. We're getting input from all around the country. Any questions about the CDP? Yes?
So does it have to be renewed? I believe it does, correct?
So that conversation, so it'll come out next year.
Okay.
And as we're having these conversations, we're hearing that people want it to be renewed because it continues to validate in its, because the certification. They're saying that it takes value away when we don't require renewal. We've been told, please don't let people just earn it and just keep it forever. So that's the feedback we've been getting, but we're still having the conversation.
And they would have to keep their original CDA to be renewed in order, like, can you just, because we have a hard time just getting them to renew one CDA,
Yes.
let alone two.
Yes. So once you earn your CDA and you want to go into CDP, you can keep your CDA and then earn your CDP, or you can decide later, when I renew, I only want my CDP renewed.
Oh.
Right?
And that is still would cover career pathways?
So,
CDP hasn't been introduced.
yeah. Yeah, but one,
Again, it's very new in its concept.
Yeah.
But that would be a consideration of how it might be treated in the future.
yeah, once you earn it, you earn it. So you can be Bisa Lewis CDA, CDP. And then later you say, you know what, I'm just good with being Bisa Lewis CDP. So, yeah. Other questions about the CDP concept? Coursework. So we are looking at the areas. We feel like, honestly, we just met, my team assembled with several council staff last week in DC, just having the conversation. We feel like our predecessors did probably too good of a job. You got the 8 CDA subject areas, and you have the 6 competency goals. So we're trying to figure out how a way to streamline it all. However, CDPs, we want to make sure that we're showing the education and demonstration they need to be elite, to stay elite teacher in the field. So for instance, just advancing it a bit in terms of lesson planning. Right now in the portfolio, do they have to create their lesson plans? No. They can say, these are lesson plans. I saw them implemented the classroom I was in, right? So, yeah. But CDPs, we would want them to create their own, right? So maybe more creation versus just, right now, CDAs just have to show that they know what it looks like and how it's implemented. And so we're looking at more, advancing those a little bit. And we'll be engaged in the field with that. Yes?
So, I know she said coursework, but you don't know like how many hours or anything, like the 120 is what
Yeah.
I'm saying.
So we've had a conversation, we've been having conversations about 120 and finding out where did that come from, what's his history, should we stick with it? Because we know it's hard to fit those 120 into your coursework. 135 would be easy because it's just, 15, 45 hours for your courses, right? It would be easy in terms of aligning with higher ed, but 120 is hard to fit into your program. So we're looking at how many hours of education we will require, and if the 120 is our brand to stick with, or we should go with a different number. And the other part of that is, now that I have a whole CDA with 120 hours, we're asking them to do a whole nother level of education. Is it another 120, or so we're assessing that. Decisions are being made. You're going to have a chance to weigh in a little bit about that. Yes.
So I think I know the answer, but I wanted to confirm. Since you're describing the CDA as the best first step,
Yes.
CDP as
The best next step. Mhm.
is there any transferability of coursework from that CDA towards the CDP?
So when we determine the CDP areas, it would need to be the education that they've earned after the CDA, right? Yeah. Yeah, it will be after the CDA. So we're building on that. So it will be more in-depth coursework. Like, we know with the CDA they have child abuse, so maybe we'll be trauma-informed care or something. And we don't want to just make it arbitrary. We want to be careful about what we're requiring. Yes.
So currently, how many extra hours do they need to renew? I don't remember that. Like to renew the.
They have to have 45 hours. Yeah. So in the 3 years.
To renew, you could be working towards.
Yeah, we eventually want people to, instead of continuing to renew their CDA like they have been for decades because there was nothing else, right? We want them to eventually be CDPs. But we're not taking the right away to renew your CDA.
So it could be, that's where the layer could be.
Uh-huh. Yeah. Yeah.
I had another question.
Uh-huh.
So have you already had people attain this credential? And if so, are you tracking to see if there's any wage increases that correlate to them obtaining this credential?
Yeah, so we're in phase 1, the concept phase right now, and we're having the conversations just like they did with the CDA 50 years ago. Early 70s, they were having these conversations in terms of concept. And so our goal is to launch next year. Yeah, so launching the actual credential late next year. Everybody's ready for it like now, but later next year. So this conversation is really important to us. All right, so I want to engage you guys. I want to make sure I take your input back to the office. And so I'm going to have you talk and use your Post-it notes at your table and again, feel free to talk with one another. I want you to think about what criteria you would expect to exhibit advanced competency in our field. So we're looking at the education, work experience, assessment, and evaluation. What do you want us to consider when it comes to the education requirement? It's 120 with the CDA. The CDA subject areas. What do you think we should consider for the CDA? What should be the requirements? Work experience. It's 480 hours for the CDA. How many should we consider for the CDP? What else should we consider for the CDP? We're requiring lead teacher 2 years as a lead teacher. So think about work experience. Assessment evaluation. You already know it's the CDA exam, the portfolio, all of those pieces. Think about what you want us to consider for the CDP. So let's look at time. Can we take 10 minutes?
Sure.
Is that okay? So put your notes here on one of these, and I'm going to put the charts up on the wall, me and Judith, and then you'll be able to place your stickies on each of these columns. Yes?
My question was, how is family childcare going to fall?
It would be birth to 5. It would be a birth to 5 credential. It would be based on the KSAs and not the setting. Make sure you ask that when we come back, because it's an important question. It's not family childcare. It's based on your work with young children. Yeah, so please, Mary Beth, make sure I answer that. I love the responses. I just be brief and just kind of going over what you shared. In terms of education, someone simply just said double the CDA, which is fine, right? CDA is currently 120 hours. One group is saying 240 hours. In collaboration with college programs for content, right? Something to think about. Specific curriculum to ensure quality. Show that they know how to actually individualize activity plans, so several long curriculum, DAP, so yes, developmentally appropriate practices, so that they don't forget that information. That's good. So one place, how can this lead to an AA? And that's a conversation that you all will be having in Ohio, right? Yeah, so we'll come back to that. Someone said more child development theory. 45 hours in all competency areas is what someone said. And then improving mastery in established areas. Classroom management, yes. Cultural competency, yeah. So that's kind of the summary of those. Someone said possibly none, because a CDP could help those who have CDA from being stagnant, or if they needed education and then associates. So, something to think about. Do we require education at all? For work experience, and before I move on from education, anyone want to share a key point that I did not make for theirs? Because you guys had some great conversations. Anyone want to share a key point? Okay, good. For work experience, again, double the CDA. We currently require 480 hours. So that would be, what, 960? I see this 2 or 3 times about measuring in, instead of years, hours, because again, we're saying 2 years in the role, working in 2 years, working in the role as 2 years lead teacher. What we may have to do if we do go with the 2 years is just break it down like I did for you today. That's 4,000 hours part-time and 2,000 full-time. Part-time, sorry, switch that. Because I break that down with the CDA as well. With the CDA, those 480 hours break down to about 3 months working full-time and about 6 months working part-time. So it kind of gives you just enough time to make it over that, first 90 days. So yeah, so similar, breaking it down by hours and not just years. I hear you on that. There should be a mentor who has credentials above a CDA. Yes. Do you see this aligning with your apprenticeship program work? Yeah, it would be great to integrate both, where they can earn both. Even though the apprenticeship is considered to be a national credential already, you can integrate both. Part of a state-rated system other than licensing. Okay, that's pretty good. Reflective practice and growth. And what age groups count. So the CDP, like the CDA, would be a birth to 5 credential. The difference is that the CDP would be focused on the art and science of teaching, like doing the job as a lead teacher. The CDA is offered in settings, right? Infant, toddler, preschool, family child care, home visitor. The CDP would be the CDP. Can you work with young children? Do you know how to teach them, right? You know how to lead a classroom of young children. For assessment evaluation, observing programs similar to CDA, scenario-based testing. I can tell you that our psychometrics team they do, when they lay out everything, it's like looking at algebra. It's, when they tell us these levels and how things count. There are ways that you can do scenarios without being actually in person in the classroom. So we are looking at that because we know PDSs, y'all are trying to go all over the state and everywhere you can and cover it. So not taking that job away from you, but offering some options using the latest technology. Observation from a certified PDS. Okay, yes. Like for CDA, open-ended responses, classroom scenarios. Explain your lesson plan and the process. So PDS looking for lesson plan cycle. I gotcha. Written exam, interview with in-person verification visit, a NACE center. So basically the work should be done, the observation should be done in a NACE accredited center. is what someone is saying. Ohio's early childhood competencies considered enough for evaluation. Okay. Anyone have one here that I didn't mention that you feel like should be stressed today? I don't want to miss any key points. Yes.
I'm not sure if the one you read, the NACE one, I was suggesting that if we use the NACE accreditation tool at center, so not having to do it at a center, but
Got it.
look at the NACE for if you're going to be an accredited center, look at what they're already expecting, and maybe we can drop them there.
Gotcha, good point. And if you go on our website to resource library at the top right, you'll see an alignment with the CDA and the NACE competencies, so that can make it easier for you. You'll also see an alignment with the CDA subject areas and the competency standards. So give yourselves a hand for playing with us on that. That's really good. I'll be taking a picture of those and taking it back to the office as we consider how this will look. Make sure you'll have information today. I'll go ahead and pass those out as I get ready to finish these last few slides. But I want you to stay engaged with us. And I'll share the link on the screen as well. We have a consortium for higher education that I want you to get involved in. So while these are coming around, I'm going to highlight a few more key points for you and then see if there are any more questions. Thank you. So a lot of these links, these QR codes that you'll see, they're on your handout. The top is English, and then the bottom section is Spanish.
I have one more suggestion.
Yes. Sure.
To think about. So our teachers who have their CDA, time is money, money's time.
Mm-hmm.
Perhaps rather than a 2-year work history experience, because 2 years is a very long time for people who live and work in poverty. It's just an enormous amount of
Okay.
money.
Okay.
Reduce that to 1 year, make it manageable, make it realistic.
Okay.
And then when it comes to the renewal period, give them more time to renew. So maybe a 5-year renewal period. Give
Instead
them
of a 3?
time back because they are often working several jobs.
Okay, so a 5-year renewal. And you're recommending 1 year, and they can apply to be a CDP. Okay. So we'll take that back. Thank you. So just some key points to remember about the CDP, because you all will be continuing conversations. Just remember, in alignment with the council's history, specific eligibility requirements will be determined based on data we require from the field. So when you receive emails from us, and we invite you to a survey, or we invite you to a special session, we really do want that information. Do you know the CDA, when it was originally designed, was only going to be an exam? But a task force got together, and they was actually called the Black Task Force. They got together and decided, no one should be a credential if they are not observed working with children. And that's how the portfolio and the observation came about from this task force that said, no, we can't credential folks nationally based on just an exam. And so your input matters. Had they not given that input and provided that guidance, the CDA would not be what it is today. The general timeline from concept to credentialing based on our psychometrics team is 9 months. So again, the concept paper was launched in May. Give us about 9 months to start, collecting all the data and moving forward with now you can apply for a CDA. So sometime in 2026. So we'll preserve and support access to all the career level choices, because you guys were asking about renewal, including continuation of renewal, for anyone who wants to maintain their CDA credential. So they want a CDA, again, a CDP. We don't want them to lose that. We want to stack and build career pathways. Well, all of the vacancies and the data I showed you earlier, we should not be making it harder for someone to work with young children, right? It's not like you're gonna pay them a 6-figure salary for doing this job. So let's make sure that it's quality, but we're not overdoing it. So I want to share some resources with you guys. You're familiar with these books likely, right? Use them in your classes. So these are the CDA competency standards books. This is where you can find all the actual competency standards detail. It's about 100 pages, but it's all the standards I showed you broken down with the indicators and the items and all the information that you need to apply for your CDA. Yellow books are infant toddler, Green books are preschool, purple books are home visitor. What my home visitor people? I heard you say home visitor. And home visitors here, yay. And then we have family child care as well. So those are the CDA books, and there's a new Credential setting that was launched in August last month. Who knows what it is? It's a magenta book. You know, every time one of us says hot pink, the marketing team goes magenta. So there's a magenta book that is birth to 5. And we've already had like so many, I can't remember the number, I don't know its quote, but so many CDAs who have infant, toddler, or preschool have already applied for their birth to 5. Yes?
So we used to use the green one in
Yeah.
our portfolio.
Yes.
But then, I don't, will bookstores be able to buy it? Because I think if students are using financial aid, they can't just go on the website and buy it, like they'd have to buy it through our bookstore. So does the council sell through the bookstore, or is there a way to?
There, you can, shoot us an email, because there is a way that they do this, that we can invoice them and they buy them in bulk all the time.
Okay.
So definitely we can make that happen.
They used to have it, and then something happened, they said they couldn't get it.
Yeah, we can work that out, no worries. Yeah.
Birth to 5 book has not been, it's been on that.
It's on back order, yeah.
It's on that, yeah.
And it's because there were so many that were ordered immediately, but still order, because you'll be the first one to get yours, so please still order them. There were like 2,000-3,000 that were ordered the first week. Here's the link to the council store. Again, you have that QR code on your handout that you just received, so you can go to our store and play around and look for those resources. If you're not already using our Essentials book in your program, it's already outlined. It's 6 units, which is the 6 competency goals. It's 13 chapters, 13 functional areas. So it's already broken down for you, and you can definitely use it maybe an intro course, or those of you guys who are already doing CDA training, I would definitely use it as my textbook. And again, just work with the council to provide that. If you're in a CTE program, you can use your Perkins funds to get any of these books. Who has seen the CDA handbook for high school? If you work with high school or CTE, there's a CDA handbook for high school. You can download it. That one's free, and it has budgets, everything, instruction plans, everything you need in there to do your high school course. When I was a CTE instructor in high school, I was so happy to work with the council. That became my baby, right? So it's something that is realistic that you can use. It has the FCCLA and the programs in there that we have to put Educators Rising in the next one. But it shows you how you can support the candidates in high school. So here's some ways to stay connected. Who's already a member of CAN, our Council Alumni Network? Please join CAN, because this gives you an opportunity to connect in different groups. We have a career and technical education group, CTE. We have a higher education consortium. We have webinars. We have one-on-ones. We have events that can support you. If you were already in CAN before August, the council started with a whole new software. So that's the difference you may see. Make sure you go back in and set up your new profile. This new software allows you to do a whole lot more. Technology advances, right? And so it was too hard to do some things through the other software that was there, but now that technology has advanced, we advance with it. And this one allows you to do a whole lot more with fewer steps that we don't have time to complete as professionals. So make sure you join CAN. Our EC Competence and Practice team, Vilma, Marie, and myself, we manage 3 communities in CAN. We manage the Higher Education Consortium, so that's pretty much all of you all. Lazos Latinos, which is Latin Links, Vilma manages that to make sure that all of our Spanish-speaking population has a place to connect. We also manage home visitors, right? But there is a CTE group that is not on here. We manage a CTE network. It's fairly new, but we also have a CTE network. And every quarter, we have what we call Cafe Q&A. It's just our team, and we connect over content. It's on Zoom, and you can pretty much ask us anything. So make sure that you are connecting with us so we can answer some of these questions and solve some of the puzzles as you are working. If you haven't already, in addition to the handout you have, that's just the CDP concept paper, but what can help you even more is the blog post that contains that paper. So make sure you check out the blog post that came out on May 6th announcing the CDP, the best next step. Participate in our stakeholder meetings and webinars. Thanks to all of those who've been keeping up with those monthly CDP webinars. We just finished the last one a couple of weeks ago. And in 2026, as we're launching the CDP, we'll have more because you'll want to know more, right? Like now, here are the requirements, and you all will have questions, so we'll engage you even more. But in CARE, we're always having some type of webinars to support you. So make sure that you're connecting there. And then here's our information. If you're not already following us on socials, please do. When I tell you the council has like 2 or 3 posts a day, because we're always trying to recognize CDAs, especially men in the field. We want more men in the field. We want people from different backgrounds in the field. But we also share a lot of information in events. So make sure you're following the council on all of its socials. I am pausing now for questions. I wasn't that good now. I know you have questions. I mean, thank you, but I know you have questions. I answering along the way. Do I get a star? Okay. Before we break, if we're breaking, I would love to get that photo with the PDSs. So if y'all will meet me like out there when we break, that would be great.